श्री धन्वन्तरये नमः। ॐ श्री धन्वन्तरये नमः। ॐ श्री धन्वन्तरये नमः।
Ayurvedic treatment modalities in children. The Department of Kaumarabhritya of Government Ayurveda College, Thiruvananthapuram is well known for managing developmental disorders in children using modified Panchakarma treatment procedures. Here we are presenting an audio-visual demonstration of Ayurvedic treatment modalities in children which are being practiced in our institution. Udvartana, the process of rubbing dry powder on the body in the direction opposite to that of hair roots is called Udvartana. The materials required are Kolakulattadi churna or Eva churna, a clean cotton towel. In the procedure, the dry powder is rubbed over the body of the child starting from the legs towards the abdomen, chest and hands in the anti-gravity direction. This process is carried out with a gentle pressure in children and lasts for 20 to 25 minutes. Finally, the remaining powder is removed from the body with the cloth and the child is allowed to rest.
This is a case of cerebral palsy due to meningitis. We are going to do Udvartana treatment.
Abhyanga, the process of application of Snehadravya over the body with a mild massage is Abhyanga. It is one of the Bahya Snehana procedures. It can be applied all over the body or locally. The requirements are medicated oil, which is processed in Karapaka, a cotton cloth, and 2 therapies. The oil is made lukewarm before the application. It is applied over the child's ears, head, and soles as a preoperative procedure. During the procedure, the medicated oil is applied all over the body of the child by the 2 therapists standing on either side of the table. The massage should start from the scalp and proceed towards the feet. Pressure should be mild in children. Here, Abhyanga should be done in sitting, supine, right lateral and left lateral positions. After the completion of massage, the oil should be wiped off with a clean cloth. The procedure is carried out for 20 to 30 minutes in children. As a post-operative measure, the child is allowed to rest for half to 1 hour and given a bath later.
It is a case of intrauterine growth retardation caused due to touch infection. And Abhyanga is one of the treatments which can be used in such cases.
Kayasekam. Kayasekam is a type of Snigdha where lukewarm oil is poured all over the body in a specified manner. The required materials are medicated oil, cotton cloth, medicated oil and churna for talam, coconut leaf and Gandharva Hastadika Shaya. As a pre-operative measure, mild abhyanka is done and talam is applied over the scalp. The cotton pieces are soaked in warm oil and are squeezed in order to pour the oil all over the child's body. The oil should flow in a uniform stream from the thumb pointing downwards and from a specific height. The procedure is carried out in positions as an abhyanka and for the duration of 20 to 30 minutes. Finally, oil is wiped off using coconut leaves. Talam is removed and Rasnadi Churna is applied. Gandharva Hastadi Kashayam is given for eliminating the doshas in the koshta.
This is a case of cerebral palsy following forceps delivery. Here we are going to do Pirichil, which is an effective Ayurvedic management in this case.
Shashtika Lepa. It is a type of Snigdha done with Shashtika Shali. It is Brahmana in effect. If it is done in the form of a bolus, it is known as Shashtika Shali Pinda Sweda. The requirements are Shashtika Shali, Balamula, milk, oil and churna for talam, oil for abhyanga, coconut leaves and cotton cloth. Preparation of medicine. 1 liter of Balamula Kashaya is mixed with 1 liter of milk. 200 to 250 gram of Shashtika Shali is cooked in this mixture till it becomes thick and semi-solid. Before starting the procedure, talam is applied over the scalp. A mild and gentle massage is done all over the body and the lukewarm paste of Shashtika rice is applied and mildly rubbed for a duration of 30 minutes. After completion of the procedure, the medicine is scraped off using coconut leaves and the body is cleaned with a clean cotton towel.
It is a case of cerebral palsy due to neonatal jaundice. Shastika Leba is one of the treatment for this condition.
Shirupichu. This is a type of murdathaila wherein a piece of cotton soaked in oil is kept over the scalp. The requirements are a piece of cotton, cotton cloth, medicated oil as per the condition and rasnadi churna. As a prerequisite, the hair over the scalp is completely removed for better results. Procedure is a gentle massage is done on the scalp. A piece of cotton is placed over the scalp of the child. The oil, which is made lukewarm, is poured near the anterior fontanel region over the cotton. After the duration of 30 minutes to 1 hour as per the condition of the child. The cotton is removed and the oil is wiped off with the cloth. A pinch of Rasnadi Churna is applied over the scalp and the child is allowed to rest.
This is the case of congenital hydrocephalus. We are treating such conditions here, and one of the effective management for this is being Shiropichu. That's what we are going to do in this patient.
Shirolepa. It is a type of Svedana for which the requirements are medicinal powders, Rasnadi Churna or Panchagandha Churna for Lepa, Amalaki, Musta, milk, lotus leaf, medicated oil and Churna for Talam. Takra is prepared out of the milk boiled with Musta. Amalaki soaked in this takra is made into a paste and the churna is added to it. This paste is applied over the scalp of the child and covered with the lotus leaf and tied. The talam is applied over the anterior fontanel region. The post-treatment measures are same as that of Shiropichu.
Here we are going to do Shirolebam in a case of speech impairment associated with cerebral palsy.
Nasyam. Nasyam is a process of instilling medicated oil or churna in the nostrils. Snehana and Svedana are done locally on the forehead, maxillary region, neck and upper chest of the child as the preoperative procedure. The oil is instilled in each nostril with the help of a wick. Here, the process is done with the help of a small container from which the oil is instilled directly. In case of Mananasya, the powders are blown with the help of a specialized instrument. In children above the age of 7 years, Marshanasya can be done, for which the post-treatment measure is Kabala with lukewarm water. In younger children, only Pratimarshanasya is carried out and it requires no post-treatment measure.
This is a case of mental retardation. The cause being obstructed labor due to breech presentation. Nasya is being carried out.
Upanaha. It is a type of Svedana. Medicines like Kolakulatadi Churna are boiled in milk and made into a thick paste. After mild abhyanga, lukewarm paste is applied over the limbs and covered with a cloth. The procedure is helpful in pediatric conditions with increased muscle tone like spastic cerebral palsy.
This is a case of cerebral palsy due to neonatal asphyxia. Among the Ayurvedic treatments, Upanaha is having the best result.